Good morning and a very warm welcome to escaide 2022, the European Scientific Conference on Applied Infectious Disease Epidemiology. I always say that word wrong, I don't know why. My name is Jackie Davis. I'll be your Master of Ceremonies over the next 3 days as we explore and discuss public health challenges in infectious diseases and hear about the latest scientific advances. And I'll be guiding you through a mixture of plenary sessions with high-level speakers discussing important topics in infectious disease and public health. We're going to have oral and poster abstract presentations, providing a platform for sharing the latest in cutting-edge research in a broad spectrum of fields. And there'll be moderated fireside sessions. We're calling them fireside. We don't actually have a fireplace, but we're calling them fireside sessions because they're going to be intimate conversations, and poster tours, where abstract presenters will delve deeper into their research and take your questions. And then there'll be other abstracts that will be accessible only in an online exhibition, plus some side events organised by third parties. So a packed agenda, and we'll tell you more about that later on. But I want to start with a little bit of housekeeping, and sorry, this will take a little while just to explain to you how everything works, because as you know, we have many people with us in the room, and it's lovely to be meeting in person again, but we also have many people joining us online, and I'd like to extend a very warm welcome, particularly to all of you at this moment. Let's have a round of applause for our remote audience. Very good to have you with us here today. Now, because it's a hybrid, the organisers have been working very hard to make sure that everyone has the same opportunities to hear what all our speakers have to say, to join our discussions with their questions and comments, and to network. So we're going to do this through an app, a wonderful app. Everything you need is on the conference platform, and it's called Swapcard. You should have received an email several times, but even yesterday, saying click here to join Swapcard. Or you can download it on the Apple Store or Google Play. And just to mention, in the interest of sustainability, we've printed very few materials for this event because the information you need is on the app. We wanted to limit the use of paper, and this event is also being carbon offset. So, even if you're here in the room, please do make sure that you download the app so that you can access the programme, connect with participants, and interact during the sessions. Everything, for those of you watching online, everything is streamed online. And you can always find the sessions that are underway under the Live tab, or you can go through the Programme tab. And you can bookmark sessions in order to create your own agenda, which is probably a good idea because some of the timings are quite complicated. So to keep track of where you should be when to see the things you want to see, that's really helpful. But if you miss something, the sessions are being recorded and will be uploaded the following day. So you can always, if you missed a session because it was parallel to the one you were attending, or you just want to watch it again because it was so good, from tomorrow, the sessions from today will be uploaded. And every abstract that's presented at escaide has its own page on the platform. You can find the oral abstracts in the Firesides tab, grouped by session, and the posters, not surprisingly, in the Posters tab. There you can read the full text of the abstracts, see the posters, and leave comments and questions for the presenters at any time. We're getting there, I promise. Not much more. If you need help, there is a help desk in the entrance for those of you who are with us, and they will help you. And there's a help desk within Swapcard for any technical issues you may have. And we've also got lots of wonderful people around the place to show you where to go. But there's a floor plan, again, in Swapcard if you're trying to find the room for your session. So the most important thing, if you want to join in our discussion in the sessions, again, you use the platform. If you go into the session that you're in and you click on the button marked live discussion, you will see two buttons at the top. One is called chat and one is called questions. And please confine your comments to the chat and your questions to our speakers to the Q&A button. This will help us enormously to see what your questions are, who they are for, what it is you want to know, and please, please, please be as brief as possible to make that job easier. I'm going to be monitoring during the plenaries. I'm going to be monitoring what's coming in from you and relaying it to our wonderful moderators. And Slido is also going to be used, but for polls. So we're going to ask you a few questions from time to time. You can either scan the QR code that will appear on the screen, you can go into slido.com on your browser and put hashtag escaide2022, or there will be a link in the live discussion on Swapcard. One last plea, as we're all using our smart appliances for these sessions, could you please make sure they are silent once the session starts? And crucially, let's get that escaide message out. Please do tweet about what you're hearing at this event using the hashtag escaide2022. So I'm going to shut up now. We're going to tell you a lot more about what is going to be happening over the next 3 days. You're going to hear from our hosts on that topic a little bit later. But we're going to move first to our first plenary. And the reason for doing it in this order is that we have a wonderful keynote speaker. And unfortunately, she was only available in this hour. So we didn't want to lose her. We wanted you to hear what she has to say. She's going to make a presentation. Get ready with your swap card because there will be time for questions later. But first of all, we are going to discuss controlling a pandemic. What are the ethical boundaries? And I'm delighted to hand over to the ECDC Director, Andrea, Ammon, our host for this event, to introduce this session and to moderate it. Andrea, over to you.
Thank you. Thank you. No? Not. Thank you. Yeah. Thank you very much, Jackie. And good morning, good afternoon, good evening, wherever you are joining us from, here in the room and online. I'm so delighted that after 3 years, we are back here again. And I heard from the incoming crowd that everybody here is also quite happy. So, but as Jackie has said, after 2 years online, this is another novelty for us to do escaide as hybrid. And a key theme this year is, of course, to reflect on COVID-19 and how we can use what we have learned from there also for our future public health responses. I was supposed to co-chair this session with Mike Catchpole, who is our chief scientist and the chair of the scientific committee who has put together this program. Unfortunately, he had to go back to the UK this morning for a family emergency, so he can't be with us. Now, Jackie has already said the Keynote is dealing with a topic that struck me as a very important aspect that we have actually very little discussed. At least from my practice, I always thought in these emergencies, when we have measures to take to protect the population or certain groups from serious disease, we take them even if this restricts the freedom of other people. Now, in this prolonged emergency, we have seen that not everybody was happy to have their freedom restricted. We have seen demonstrations and we have seen colleagues taken to court for the measures they have taken. And so for me, it was a very important matter to discuss here at the keynote, at the opening of this conference. How do we deal with this? What does it mean for us? Are we all wrong with our protective measures? Do we have to change anything? How do we even start a discussion? Are we the ones that should start this discussion? So, I am really happy that Alena Buyx, I hope she is online. Yeah, good morning, Alena.
Good morning.
Professor Alena Buyx, she is an ethicist who leads the Institute for History and Ethics of Medicine at the Technical University of Munich and is also chair of the German Ethics Council. And this Ethics Council has deliberated on this topic quite a bit during this pandemic. I am really happy that you took the time to share your experience with us. And I give the floor to you now that we can make most of the time that you have available. Please, over to you, Alena.
Thank you so much, Andrea. And thank you so much for being with you. I'm so sorry that I can't be in the room. I'm sitting in a little cubicle here and I would much rather feel the energy that keeps coming out of my laptop this morning. It is a true delight to talk to you today. I was given quite a big task to talk to you about the ethical boundaries of controlling a pandemic. Now that is a tall order. I'm not sure I will be fulfilling it, but I can give you a few pointers and some thoughts. Before I start though, you need to do something so that it's not just me working here. As far as I understand, you have Slido links, and this is a little poll that we want to kick things off with, asking you how confident you are about assessing and advising on ethical issues in public health planning. And you have different options that you can respond to, and we will look at the results in the end. Towards the end of my presentation, and maybe we can pick this up in the discussion. So while you're answering, permit me to start with a bit of a personal anecdote. Andrea just said that the German Ethics Council advised early on in the pandemic and throughout the course of this pandemic. So we've had quite a bit of interaction with policy making, quite a bit of advisory. And I remember very distinctly that we thought in the summer of 2021, things are pretty much done now. We've got a handle on this pandemic. Now that wasn't correct, at least not for Germany. But at that time, we were very hopeful. I think it was June 2021, and we convened a meeting at the German Ethics Council where we invited several international experts to just tell us what happened in their countries. How had they dealt with everything? How had they navigated the ethical complexities of such a worldwide pandemic? And we wanted to hear from them. And there was a colleague that many of you might know, Ross Upshaw from Canada, who's a very distinguished public health ethicist. He's been around the block for 30 years and more. He's been writing on the ethics of pandemics. And he told us that when SARS-1 happened, that after that outbreak, there were many articles, but also news items, lessons learned from SARS. And that the same happened with Ebola. So lessons learned from Ebola. What can we do? What have we learned? And the same happened after swine flu, lessons learned from swine flu, and lessons learned from influenza, and lessons learned from all the other infectious diseases. And Ross then turned to us and said, the only lesson we have learned over the last decades is we do not like to learn lessons. So all the ethical considerations had been worked out. So much advice to policymakers, so many smart people working on smart things, and yet most of that has not penetrated. And Andrea said it in her introduction. Ethical complexities of crises such as this are still something that we don't really talk about very much. And so that's why it really gives me pleasure that I have the opportunity to take you through a little of what we thought about, and let me say, standing on the shoulders of people such as Ross Upshaw and many others who have thought about these things for decades. So this is nothing new to any public health ethicist all of the things I will tell you now are pretty much no-brainers, but to get them into practice seems to be still a bit of a difficulty and a bit of a secret. So let me start at the beginning. What was the biggest challenge in the beginning for ethicists? From an ethical point of view, obviously it was, how can we deal with this new threat? What can we do to protect populations? How can we protect the health of people in this situation? But from the very beginning, and I'm talking here about March 2020, when it became apparent, we had the first outbreak in Germany in January. We were arrogant and thought, this is it. We've got it contained. This is not going to be a problem for us. But in March, we realized, okay, this is going to be a bigger issue. And the German Ethics Council, like many other bodies, convened a group, and we wrote through the night, several days, and we published a very early paper. And we specified that there is a core ethical conflict in a situation such as this, that it's not just protecting health. It is not just the measures that we have to take, but that at the same time and from the beginning, we have to balance these measures and their impact against other social goods. We have to look at the consequences for people and for society, at the stability of the social system, and we have to do that under conditions of extreme uncertainty regarding the pathogen, but of course also any protective measures such as vaccines, drugs, therapies, tests, and so on. Everything we now have, we didn't have in the beginning. And that means from the very start that we are in an ethically extremely challenging situation, that we have to balance competing moral goods. It's a super, super simple message from an ethicist, but it's supremely difficult to grasp in a crisis situation, in a global crisis situation, where the obvious thing to do is to protect health. And so we wrote this little opinion. It's still online. You can look at it. It's been translated into English, and it says some very, very simple things. It says, in a situation, and we're talking beginning here, so I'm going to take you through this fairly quickly because I do want to get to the lessons. But just so you remember, it says, in a situation such as this, where we have to balance these social goods, obviously the threat to health is immediate. We don't know exactly how this pathogen will affect our populations. So a laissez-faire strategy, just letting it roll through our country, and Germany is a very old country with a very elderly demographic, is irresponsible. So this idea of getting towards herd immunity as quickly as possible, we said from an ethical point of view, that's irresponsible. We argued that in a situation such as this, flatten the curve, you remember that was sort of the term, is definitely the better strategy, and that in doing so, very strong measures are ethically justified, particularly at the beginning of such a crisis. But, that's what I said before, they must be balanced against the social and economic consequences from the beginning. We cannot forget these, and we have to consider the time frame. So the longer strong measures are in place, the more it's necessary to monitor and to balance them against their consequences. It's also essential, we said early on, that such measures, even though they are developed by the public health community and they are implemented by policymakers that are looking after health systems, they must have democratic legitimacy. So that meant that we urged parliaments to get involved, and that was something that almost 3 years later, as you know, has high significance. We also urged to continuously monitor the proportionality of these measures. Now, this is something many of you will be familiar with. It's the letter of intervention by the NAFL Council on Bioethics, where you sort of get towards stricter and stricter measures, the strongest one to eliminate choice entirely. And the simple message of this letter of intervention is that proportionality means the stricter you are, the more you need to look at all the different risks that might be connected with this measure, and keep those in mind as well. And the quicker you have to get down the ladder again. And that meant that we also emphasized that we're in a situation where we need to emphasize both solidarity, which is something that for public health ethicists is very important, protecting the vulnerable, all of us together do something so that we protect everybody. But at the same time, personal responsibility must play an important role. And it's not either or, it is both of these things. It also means that we need to have a very wide understanding of social goods. We need to understand that health is not just bodily health. Health is not just hospitals. Health is psychological health. Social goods are the economic, the social, the personal impacts that our health measures can have. All of these things need to be taken into account. If you close down sectors of society, all the implications that can come back to health, of course, of populations, and I will tell you about some of the examples there in a minute, need to be taken into account. And finally, for a situation such as this, even in the beginning, you need to start planning your exit scenarios. Restricting personal liberties of populations is one of the strongest and most intense things that you can do from a policy side of things. And in order to keep proportionality, you need to already put the pathways in place so that you can stop that again. And the very final thing that we did in this paper was, because there was such intense pressure, you remember that, I'm just mentioning this, I'm not going into detail here, you have to look at the allocation conflicts that you have. And of course, in the beginning, you might remember the horrible images we saw in some places in the world, New York, Bergamo, some other places. You need some frameworks that ensure that if you get into a situation of triage, where you cannot care for everybody who might need it, you have at least frameworks in place that make sure that even though these are tragic decisions, they aren't unprincipled, but they are based on good ethical principles. We were very lucky in Germany that we never had to put that into place, but we had to develop them. So, fast forward 2.5 years, what have we learned after a long time? We published a paper, it's 270 pages in April, and we pretty much said something very similar to what I said in the beginning. We emphasized again that the main, or one of the main messages, we have two main messages in this paper. One, and the likely most important one for the public, is that we have to weigh social goods, that there is not the one policy. You may remember there was a conflict between the no COVID camp on the one hand and the sort of laissez-faire proponents on the other, and that these extreme ways from an ethical point of view will not be the ones to follow, but that we have to constantly readjust and we have to constantly weigh all the social goods that we touch upon. And the second message, and that is something that we learned over the course of this pandemic, was that we have to focus more on vulnerability and resilience. We have to understand that vulnerability in the beginning might mean looking at medical vulnerability, the very elderly, people with particular risks for COVID-19 were most vulnerable, and we had to protect them early on because they were medically most vulnerable. But that vulnerability has several dimensions, that, for example, psychological or social or socioeconomic vulnerability plays a role. Some populations, some groups in the population were affected a lot more by the pandemic and a lot more by the negative effects of certain restrictive measures than others, because they were already vulnerable to start with. And the most telling example to me is what happened to the younger generations, for example, in Germany, who started out and dealt with the first lockdown quite well. There's a lot of data on this. But who then, the longer this pandemic lasted, became more vulnerable because they lost so many moments of individuation, so many moments of development, personal development, so many moments of social connection over the long period of time that now we see, and we see this in very good, robust meta-studies, that the psychological health has deteriorated in these groups. And this is something where we say very clearly, this was not seen early enough, and the reaction, at least in Germany, wasn't good enough. So this focus on vulnerability and its counterpart, resilience, how to lessen vulnerability and empower individuals, certain vulnerable groups, but also institutions, that's something that we looked at, and we measured this. We tested this against a number of ethical criteria. You will know all of these: freedom, human rights, justice, solidarity, trust and responsibility. All of these are very well known, but we focus them through the lens of vulnerability and resilience. So what did we learn? I will be very quick. I will give you these 7 overarching specific lessons, and then I will only show you the 12 policy recommendations that we made, because these are very specific to Germany, and they might be very different to where you are. But I just want to speak a little about these overarching lessons. The one is, obviously, we need to focus more in a crisis like this on vulnerability. We need to be prepared better. We need to understand who is going to be vulnerable. In a pandemic, it might be with a pathogen like SARS-CoV-2. It might be the elderly, those with specific health risks. Now we have other crises. We have an energy crisis, for example, because of the war in Ukraine, and very different groups might now be vulnerable. The next pandemic might have a different kind of virus that again affects other groups. So we have to be quick about anticipating and then very quickly confirming who are the vulnerable, how can we protect them? And we were too slow about this. At the same time, that means extending the proportionality criterion. So we always have to weigh how strong are our measures, when can we lift them again? But we also have to check, it might be that measures are proportionate on the whole, but they affect certain groups so much who are so specifically vulnerable that we might have to readjust. So we always have to check what are the risks of our measures to certain groups, and how do these risks affect the most vulnerable. And that, for example, happened in care homes in Germany, where we had people in such extreme isolation that they were harmed more by the measures than probably by the risk to their health. And the proportionality criterion then has to be extended with a focus towards these vulnerabilities. We also have to learn as societies, and that is something that is very difficult, to tolerate that we will continuously have to readjust, that we live in situations of uncertainty, that we have to accept certain risks. That's something that to public health people is quite understandable. Epidemiologists deal with risks continuously, many other specialties, but this is not something that is so very clear to the public. Another obvious lesson is restricting freedom is an exception. Even though from a health perspective, it's the obvious thing to do, it might be the obvious thing to do, it is an exception. And we must accept that sometimes in the last 2.5 years, there were situations where freedoms were restricted too much or for too long. So we also need to be self-critical about this. We need to be able to discuss. In clinical medicine, we do this in the M&M conferences, mortality and morbidity conferences, where we look at cases that didn't go well and we analyze what didn't go well and why. And in order to do that, we can't put over too much blame on individuals, but we have to sort of to crucify them, but we have to be able to talk about these sorts of errors that happen. We have to learn from them. And while we do that, and that is the biggest challenge of them all, we have to stay together. That is one of the major lessons that we have learned, that discussing vulnerabilities, discussing how much we can restrict personal liberties. Think about, for example, vaccine mandates, probably one of the most contentious measures that we've ever discussed, or at least in Germany, one of the most contentious health measures that we've ever discussed. We still must try to remain in this boat together. We cannot let ourselves get polarized too much, because the big crisis requires that all of us act, that all of us help overcome such a crisis. And so that is the final, and to my mind, actually one of the most important messages that we gave. Now, I'm only going to show you these 12 recommendations. Again, they are very country specific. I just want you to know that we also made some concrete recommendations to our policymakers in Germany, a lot about how to protect the vulnerable, how to fairly distribute the burdens of health measures, but also how to get better at collecting and using data. That's a very specific issue that in Germany is very relevant, and I know other systems are better about this. How to improve public health communication, and I know there will be a lot of great input at this conference on how to improve the communication and information strategy in a situation such as this. But I will not go into this too much, because it's a very Germany specific list of recommendations. You very obviously very free to ask me about this in the discussion. I just want to use the last few minutes to say a little bit about how can we get these, to you probably fairly abstract considerations that I just gave you, how can we get them into policy making? How can we make sure that something like the negative impacts, and again, I'm using this example because it is just so telling, that happen to the younger generations, where the vulnerability increased and sort of built up over the course of the pandemic. How can we make sure that doesn't happen again? How can we make sure that these ethical considerations really get into policymaking, so that in 5 years' time, Ross Upshaw can't stand there and say, the only lesson we have learned is we don't like to learn lessons, but that we actually have taken something from this difficult and challenging time. And I don't have the perfect recipe. There are a number of papers and articles that have been published on this topic, and I'm just very, very broadly summarizing them. But there are a few things that can be done. One is these kinds of considerations. And again, March 2020, fairly early on, things that are still absolutely true. Things, I read that paper, it's a short paper, that opinion that we published, and I think, yes, we got it right, but we didn't do that as a country and as a society all of the time. So one of the things that has been suggested is we need to get ethics seats at the table. Ethical expertise needs to sit around decision-making tables. And that has happened in Germany. Again, I'm very fortunate that as chair of an ethics body, we were consulted often, for example, in how to allocate scarce vaccines, but not often enough. And I believe that in particular in international settings, we must get better at letting ethics in. It makes us uncomfortable. It's all quite abstract, and it sort of seems to be distracting from the order of the day, which is protect health. But we must do it. The second thing, there are a lot of tools for ethical preparedness. I'm just going to mention one, which are vulnerability indices that have been developed by wonderful colleagues to do some anticipatory assessment. And there are plenty of other such practical tools that can be used to assess checklists, for example, and help to assess the proportionality of measures. And I urge everybody to consider this, and policymakers in particular, to take these into account. Obviously, and that is the biggest and tallest order for us as societies and for policymaking, we need to work continuously to improve resilience, not just of individuals and of certain groups, but also institutional resilience. And there are thick books currently being written and big reports in healthcare systems on how to do that. We're not the experts, we just know it must be done. We also urge every society to consider better how to improve options for civil society involvement, because a lot of good impacts could have been gained from involving sort of people on the ground. And at least in Germany, that's something that we didn't do enough. And there are wonderful experts who have developed great ways, citizen councils and all kinds of interactive participatory formats. And I'm sure you will hear about some of these at this conference. And finally, and that's something that goes to all of us, that goes to our politicians, that goes to our media systems, we have to understand that we're going into a time of crisis. We are in a time of crisis. And with the climate crisis, this will not end. So we will likely see decades of crisis. And we can only withstand these and get through them well if we stay together as societies. And so my final plea to you, my final message to you is that everybody, wherever they can, in whatever context they work, whether as decision maker, as policy maker, or as a member of society, as a scientist, as somebody who works with media or in media, tries to get away from polarization, get away from the extreme, and try to work towards an informed, sober, ideally focusing on togetherness, that style of debate in the future. It's difficult, but we have to do it. Otherwise, we will not be able to address what is coming next. Thank you so much for your attention.
Yeah, thank you very much, Alena, for these really thought-provoking remarks. For me, I'm not sure. Yeah, so for me, not learning the lessons this time is definitely not an option, because I think there have been too many people dying and too many people suffered, that we owe it to them that we make something better for the next time. I think you have given us some thoughts, and while Jackie comes up to see what you have asked for questions and then summarize and put it to Alena, I just wanted to say that it's exactly this public debate that we need, because when you weigh these public goods, it's very likely that the outcome of this debate and the outcome of this discussion will differ between societies, because I mean it's a matter of accepting a risk or not, and that will differ. That's really a societal, a cultural matter that is different between peoples. I just think we all accept somehow, at least it was never debated like this, that every year 20 to 30,000 people die of influenza, and in bad seasons even more. And we never have the debate that we do anything, really about it. At least not that I'm aware. So there is a way how to come to maybe it's a tacit consensus, but there are these how should I say, agreements somehow. But I think we have to now actively stimulate this, because it was such a interruption for all our ways of working and ways of life in the past 2.5 years. So, Jackie.
Andrea, huge number of questions and comments coming in. Just to mention, first of all, though, that we are joined in the chat. We've had people welcoming us from Botswana, from India, from Turkey, from Macedonia, and right across the EU. So very warm welcome to all of you across the world. The biggest sort of, can I just ask also, ladies and gentlemen, please chat for comments, questions in the question box. Please don't put them in both, because I'm having to scroll through both and I keep reading the same things twice. So the biggest question of all relates to communications. But the really difficult one, Alena, is about blame and the blame game. And this all comes to the relationship between scientific advisors and politicians and how things are communicated. Because Florian Burkhardt says, outsourcing blame, the Ethics Council, I'm guessing from the name Florian Germany, is not democratically elected, yet elected politicians were hiding behind the council's decisions and made drastic decisions. Can you comment on this conundrum? And Neville Kayea says, this happens in every politically difficult situation. Credit for good outcomes, politicians take it. Blame for bad ones, it goes to the Ethics Council. And there's an interesting one here. Florian then followed up saying, squaring the circle, in 2020, the Ethics Council recommended school closures to protect the elderly. And in 2021, it criticised mental health's effects on young generations and the burdens. Is this hypocritical? So really a whole set of questions around who communicates and who gets the blame.
Yeah, but I think one of the things is we have to also see, especially in such a protracted crisis, that situations may change, and that may that the foundations for certain decisions also may change. Alena, please.
Yes, thank you. This is very helpful because it's wrong. So these questions say something that's not correct, and that shows the problem. The Ethics Council never decided on anything, for example, and it never suggested school closures. It's very interesting that many people think this. So apparently what has happened is that advice, and that's not just the case with the Ethics Council, we have public health bodies, of course. They gave a lot more advice than an Ethics Council. Advice given is often taken as decision, and that is not the case. So it's absolutely true that the Ethics Council, for example, is not elected by the public. It has a democratic legitimacy. It's appointed by Parliament, so there's a law and all of that. But of course, it's not something that works with the logic of elected politics, and that's very important. It's a scientific advisory body. And so what we've seen in this pandemic is, on the one hand, we had the decision makers, the politicians, and we had many, many advisors. And in the eye of the public, that sort of seemed to get murky. And I have said in so many interviews over and over again, we advise to the best of our ability. But we have to make very clear that the decisions are taken by politicians, because they don't just listen to the ethicists, right? They listen to all kinds of different advice, and they have to bring all of that together and then make the decision. So if we're now talking about lessons learned, the German Ethics Council has really, over the last year, so we've talked about the impacts on the young generation very early on, and we said we have to balance the need of protecting the health of vulnerable groups on the one hand, with the negative impact on the younger generations. We've said that very many times over at least the last year and a half. But we've also realized that our voice wasn't heard enough, and we feel actually pretty bad about that. So we've started to do some work specifically on the younger generation. We're publishing a new opinion next Monday on the psychological health of the younger generations. So we've really taken this to heart. And I think that is one way of going about the blame game. On the one hand, we have to analyze where did it not go as well as it should have, but then we have to obviously look to the future. What can we do, at least now? What can we learn from that? How can we improve this? But the main point remains, it's very, very important to separate the logic of politicians taking decisions and those giving advice.
Yeah, I think the blame game is sort of coming from the need to find someone who is, guilty. But I think we would be all better off and learning lessons much easier if we would think, well, let's reflect what has happened and make it better in the future without any blame.
Quite a lot of comments linked to that about the communications issue, and somebody saying, if you don't get the communications right, then people won't follow the measures, and then you need more measures. And asking, do we need to rethink all of this, the way we communicate in a digital world with new infodemic management techniques? And you had a list, Alena, you said these are very specific to Germany, so I won't go into detail. But in broad terms, in terms of the communication strategy, I think quite a number of people saying, what do we need to rethink and how? I mean, presumably that point about who makes the decisions is part of that message, but are there other things that the audience want to know? Are there other things that you would suggest?
Oh, you will have a wonderful session at this conference, I know.
We have a whole session on this tomorrow afternoon as well, indeed, Alena.
I know. And my good colleague and friend, who's a wonderful expert on health communication, Cornelia Buyx, is going to be there. So she's the one to answer your question. All I can say is that many bodies, at least in Germany, were woefully unprepared in terms of communication. I mean, if you look at how public health bodies communicated, even I, as a sort of a lay person regarding communication, see that wasn't ideal. And certainly what we did with sort of the resources that we had wasn't ideal. We tried our very best to go digital. We tried our very best to tailor these complex weighing of social goods issues. I mean, those are difficult points to get across at the best of times, right? To try and get them into 20-second nuggets that will work on national television, right? Or explain a 170-page paper in the 2 minutes that you get on a national talk show. So that is quite challenging, and I'm the last person to say that we did it well. But I do want to sort of plea that I think, at least in Germany, we were very, very much behind, and that we had to do a lot of catch up. So the experts on communication will tell you that you need consistent communication. You need to see sort of similar faces. New Zealand is an excellent example in terms of public health communication. I'm not saying their policies were right, so big disclaimer, but I do recall that they very early on had a very clear plan that was communicated digitally, very well done in terms of the graphic, what will happen in what situation. It was reliable, it was simple, and it was consistent. And that has been mentioned as an early example, when many countries were still struggling with this, of doing health communication very well. And the last thing I want to say is that I believe that communication is, multifaceted. And I think we also have to be a little self-critical in terms of us as the public. What is it that we want? How complicated, how honest do we want people to be? Do we want to hear our politicians say, we don't know, we're unsure, we're trying our best, which is the truth in many of such crisis situations. And I think tomorrow you will learn a lot more about what the best way to do this is.
Can we squeeze a couple of quick fire ones in?
Can I just say, I think this links to a topic that also is close to my heart as a lesson that was learned, and that is that we have to get better in taking the population, the community with us. We lost them on the way in March and April 2020. I mean, there was such a high acceptance of the measures, and the longer it took, the less this acceptance was there. And I think we knew it was still necessary, but we couldn't get this across. And I think the other element beside the ethical principles is, for me, the engagement with the communities, with the population, to enlist the population as one of the most, the biggest allies that we could have in controlling such a crisis, because everybody has to contribute at the end. We cannot do this alone. And I think here we also have another field of learning, but maybe we come back tomorrow.
Absolutely. Can I make a suggestion, Andrea?
Yes.
We don't have long, and we have a couple of questions we want to ask the audience. So perhaps we could throw those questions out, and while they're thinking about them, squeeze another couple in from the audience. Should we go to the polls and then come back on these?
We can do this, but we can also maybe look into, Alena, could we gather some questions at topics, in topics, and then send it to you, and maybe put this as an annex to the session on the website.
So we had the question that Alena asked everybody.
Yeah.
So maybe we want to have a look at those, and then I think you've got a couple more, haven't you?
Yeah. So going back to what we asked you at the beginning, the question, you will. We ask the question now again. So please answer again the question whether how confident you are about assessing and advising on ethical issues in public health planning. So this is what we all have to do now, preparedness planning. How confident are you advising?
Takes a little while for the results to come through, so I suggest we put up the other two questions as well, and then we can come back. It takes a little while.
Yeah, but let's not.
Okay.
Let's finish this now. Yeah, it's good not to see from before. Oh, it's only 37 responding. Oh, come on. 85. Oh, 85, yeah. 92. Well, there are a few hundred in here, a few hundred joining online, so I want to see triple digits. High up. Oh, this is another question.
Yep.
Okay, so what do you require to be able to assess?
Oh, hang on. Can we keep one question at a time?
Yeah, I mean, this is a bit too...
Okay.
Give people time to think and have a look. All right, so lots still responding. Very good. So now the big question is, who should ultimately take the decision on the public health measures imposed on the citizens?
Goes back to that fascinating question about, and then communicating who took the decisions, who was responsible, and what everyone's role is. So very interesting to see how people are responding on that one, Andrea.
And it comes back to what Alena said, between advice and then the decision maker.
So we're nearly at 300 people responding to our
Yeah,
polls.
that's good.
That's great.
So can we see the comparison for the first question that we asked at the beginning?
It's going to come up in just a moment. I'm getting a signal to say that it will be with us in just a moment. So we were asking everybody about how confident they felt. And that will be with us in a second. And then what do you need to be able to advise?
So now this is the comparison. So
there we have it.
Which one was before?
I guess the left must...
The right is the one that was before. And the left, because people are still answering. So basically, it's quite similar. And I'm not surprised about that because I think there's a lot of food for thought, and that's not necessarily making you more confident or us more confident, but I think it's a sign and a signal that we are thinking about it, that we I hope we have grasped that this is an important decision, that the science is not the only thing that we have to consider. So we have still a bit of time. Alena, can you stay with? No, let's see the other two. The other question. Yeah.
So our second one about what do you need in order to be able to?
Yeah. Can you the second question, please?
This was what do you need to be able to assess and advise on ethical issues in public health planning? And then we asked who should ultimately take the decisions. So hopefully this
will come. Yes.
But quite here we are. There we go.
So information resources, guidelines, a code of practice, formal training, a mandate from the Public Health Authority. And interesting what other would be. All right. Then the third one. Who should take the decision? Majority says the national politicians. In my view, they are elected to take those decisions. So it should actually be much higher. That percentage, in my view, but the National Public Health Authority, and that is in those cases where the Public Health Authority has a risk management mandate, I would see this justified. Otherwise, I think it's really mixing the roles, in my view. But that's my view. And then some others. Yeah, the EU shouldn't impose the measures. Definitely not. And the World Health Organization cannot. I think their mandate doesn't allow imposing the measures. I mean, they can give recommendations, but they cannot impose the measures as far as I'm aware. So, Alena, what do you make of these results?
Very interesting. I can only echo what you just said. I think in democracies, politicians are elected to take these difficult decisions, and we cannot just have another body sort of pushing aside the democratically elected politicians and say, okay, now we're in charge. So I said one of the main suggestions was that we always need democratic legitimacy and that parliaments and politicians have to be involved. So I would always say the decision must be made by politicians, but it should be based on good advice. And how that works, I think that's the crucial question. And we can become better, we can become more transparent about this. We can explain this better. We talked about communication. So there's a lot to do, I think, for all of us. And the second thing that's really interesting, what would you need? And that's coming back to my very first story. Most of that is available. And I'm dreaming of a kind of an ethics repository. So I've said this publicly many times, and ethicists, my colleagues, international colleagues, we've talked a lot of, obviously, with each other. What could we do? I'm sort of dreaming of an international place, I don't know, maybe at WHO or at UNESCO, you name it, one of the international big institutions where you have all the material in one place, easily accessible, where you might possibly even have some expertise in terms of people who could sort of provide some quick ad hoc guidance initially, I think it wouldn't be that difficult to have that. And since there is so much available in terms of, codices and information, and on the literature alone on vaccine mandates. I mean, we've had literature for decades on this, a lot. It's very good. And it shows all the arguments for mandates. It shows all the arguments against mandates. It gives you the evidence, what has happened when this has been implemented in the past, and so on and so on and so on. And obviously that is growing as we speak, because we are currently, everybody's publishing on this. So I'm dreaming of a place bringing all of that together, making it easily acceptable for all policymakers pretty much in the world who could then use this.
Okay, so we will take from this session that we will see how we can make this dream true, find a repository, but I think we have to think more about how can we instigate these debates, because I think that's the most important part, and you cannot do these debates in a crisis. You have to start them when the crisis is off and agree on what are the acceptable values in advance. And that is why these things have to go in the preparedness plans. They have to, in my view, have a separate chapter in the preparedness plans. And what influence I can have when now all these plans are reviewed, I will make sure it's there. So
thank you so
commitment.
much.
Thank you very much, Alena. It was really a pleasure to have you here, and thank you so much for your expertise.
Thank you, and
thank you.
And thank you to you as well, Andrea. Thank you, Alena. Wonderful stuff.